Good morning. Good morning. Welcome to everyone, and good afternoon to our folks on the East Coast. I've got 10:59. We're going to start here at 11:01. So we'll give you a chance to get in and get settled, and then we will start. Our goal here today, folks, is we're trying to do these challenge sessions in 20 minutes or less. So we're going to have you out of here relatively quickly.
Morning, Dr. Mike.
Hey, Justin, how you doing this morning?
Doing all right, sir.
Good. Justin, do me a favor. Go back in and download a new copy of the Cracking the Code manual. We made one update in it.
Okay.
You should be able to get back in there and download a copy of it. All righty, folks. Good morning to those of you here in the Central Time Zone, Mountain Time Zone, and Pacific Time Zone. Good afternoon to those of you on the East Coast, and thank you for joining us. Today, we're going to continue on with our discussion of how to make your medical exercise training practice referral ready in 30 days. This is day number 3. Now, we've done 2 prior sessions, obviously, and with those 2 prior sessions, we've talked about getting clarity, and we also talked about your elevator speech. You can find the recordings for those. They'll post sometime later today at crackingthecode.net. Today, though, folks, we're going to talk about the idea of assess your practice readiness. Is your practice ready to accept referrals from the medical community? And I know most of you think, I got my certification as a medical exercise specialist or post-rehab conditioning specialist. I'm ready to go. I can start getting referrals. Well, folks, getting the referral is easy. It's now being able to service, manage the referral, and then communicate and follow up with the doctor, therapist, or chiropractor. So that's what we're going to talk about today. Now, I just dropped a document into the chat. It is our medical exercise training practice readiness scorecard. If you don't mind, check the chat. For those of you that are watching the recording, you just look down below. You'll be able to download the recording. Or if you go over to our blog at postrehab.com, find the MES blog there. In our session that we posted yesterday, and I'll provide a link down below. In our session we posted yesterday, you'll be able to actually download this scorecard. And we're going to talk about that this morning. All right. Now, if you would, please make sure you understand a lot of this information. Excuse me, I knocked my earpiece out. A lot of this information we're going to go over today is in one of these 2 or both of these manuals. The one I would recommend for today's information is our Advanced Medical Exercise Specialist manual. Everything we're going to go over today is in that manual. Also, for those of you that are looking to deal with insurance carriers, get our copy of the Cracking the Code manual. It takes you step by step through the process of dealing with insurance carriers and getting your practice ready to deal with insurance companies. As I mentioned earlier, the Advanced Medical Exercise Specialist will go over everything we're talking about today. And with that, we have a special seminar webinar price. Please, if you would, go over to crackingthecode.net. You can download those, and let's go ahead and get started. So again, we're talking about assess your practice readiness. So folks, I'm going to ask you some hard questions today that you need to think deeply about, give us a brutally honest answer on, and please, if you would, use this and come back to this checklist periodically as you build your practice, you put the systems and everything else in place, which we'll talk about over the next 30 days. So please, if you would, let's go over your scope of practice. Now, folks, I know this is boring, but we're going to go over it every time because as you're now moving into the realm where you're talking to healthcare providers, wellness providers, we need to be clear on your scope of practice, which is as a medical exercise specialist or medical exercise professional, medical fitness specialist, post-rehab conditioning specialist, you can provide medical exercise training assessments, which is a must. You must assess the client before you start the exercise program. And please, if you would, make sure you include vital signs assessment, check their blood pressure, heart rate at a minimum. Also, you can do cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education. I'm going to say this over and over for the next 30 days. Lifestyle education will become a much bigger component of your practice over the next 20 years. Aquatic training and stabilization training. Again, don't go outside of your scope. Massage, joint mobilization, manual therapy techniques, unless you are a licensed medical practitioner, particularly a physical therapist, physical therapy assistant, massage therapist. Stay away from those realms. And also, no electrical modalities. There's a question if the Theragun is an electrical modality, but definitely things like electric stim, ultrasound, but also even hot packs and cold packs go beyond the scope of the medical exercise professional if you're applying them to the client. And with that said, please, if you would, make sure you go over to crackingthecode.net. You'll be able to download a copy of this practice readiness scorecard. If you're not watching this live, you should be able to go down below if you're watching the recording and be able to download this readiness scorecard. If you're watching right now, we put this in the chat. So please, if you would, in the chat, let me know if you were able to download this or not. And I could put it in the chat again if necessary. Let me know if you were able to download that. And I'm going to drop it in the chat one more time just to make sure everybody gets it. It is called our MET Practice Readiness Scorecard. It's a PDF document. And I just shared it again. All right. Okay. Now, this document is going to ask you some challenging questions. Okay. We're serious now. If you're going to start working with the medical community, you need to be on point and get your systems and everything else in place. So if you don't mind, as I read through this, please read along with me, and we're going to ask you some questions. Now, use this scorecard to evaluate how prepared your medical exercise practice is to receive and manage physician referrals. This also includes physical therapist referrals, as well as chiropractic referrals. Rate each category from a 1, not in place, to a 5, fully implemented. And if you would please use your discretion for the numbers between 2 and 4. And highlight these areas and note any areas that you need to improve in, or come back and do this periodically over the next 30 days. And as you build your systems, you put things in place, note those. So if you would, our first area is practice systems and infrastructure. So if you don't mind, I'm going to read the 3 points here. Do you have intake and consent forms appropriate for medical exercise clients? Not forms you cobbled together from when you worked in a nursing home or when you worked in a physical therapy clinic or the chiropractic office, but are designed specifically for medical exercise. Rate yourself on a 1 to 5. 1 being not in place, 5 being fully in place. Do you have a structured assessment and documentation system? That means when you get a new client coming in the door, you have a system to assess whatever condition they have or their functional capabilities, along with being able to document that and then protect those documented notes and reports in a system that is HIPAA compliant and is secure. Number 3, is your scheduling, billing, and follow-up system efficient and reliable? Client makes an appointment. It's reliable. You're not going to have 2 clients showing up at the same time. If you're billing them just on a basic invoice or you're collecting money, you've done that. And if you're going to deal with insurance carriers, you have a billing system in place and you have a follow-up system for both of those. Now, here's the deal. If you say, well, yeah, I got it in place. It's in my head. That's not in place, folks. You need something that is on paper, a specific step-by-step system. If you say, I'm getting there, that's how I'm getting there. That means it's not fully in place. That's a 1. If you've got some of the pieces in place, okay, that's like a 3, 2 or 3. If you have a system in place that you can actually say, hey, Dr. Mike, I can email this to you. And if I have a new staff member that comes on board, they can follow this step-by-step process I've put in place for practice systems and infrastructure, you're good to go. All right. Next item here, medical documentation and communication. Now, folks, for every medical professional, doctors, therapists, chiropractors, we hate the documentation portion. Folks, it took me at least 1.5 years, 2 years to get really good at documenting what I was doing with my physical therapy patients. Now, we're not asking you to document at that level, but you are going to have to document and then be able to communicate with doctors, therapists, and chiropractors. So get used to it. Now, if you are a personal trainer that works with a couple of medically based clients and you just work with them and give them a workout and you're not communicating with their doctor, therapist, or chiropractor, please don't fool yourself. You're not doing medical exercise training. And I'm going to say this, it's going to sound arrogant. I'm the guy that started the very first medical exercise or post-rehab fitness course back in 1994. I think I have a say-so in this. So if you would, the guideline is if you'll work with a client that's been referred to you by a doctor, therapist, or chiropractor, and you're not communicating with and documenting what you're doing with the client, you're just doing personal training with a medically based client. If you are documenting and then communicating with the medical professional, then you are truly offering medical exercise services. So if you would, check out your practice readiness scorecard here. And let's look at item number 2, medical documentation and communication. Do you use standardized session logs and progress reports for client tracking? That means every time a client comes in, you have a session log, you document what they do. And this is for your medically based clients. Your personal training clients, that's a different story. These are clients that are coming in with a medical condition. Either they have a medical condition or they've been referred by a doctor, therapist, or chiropractor with a medical condition. Next item there, are you able to generate clear summary reports for physicians or therapists on request? They ask you for a report. Well, give me an update on what's going on with Mrs. Smith. Remember, folks, if they referred the client to you, they referred them to you with the idea your services are part of the medical management of this client's condition. So they've said there's a medical necessity here. Next item, do you have a HIPAA compliant system for storing and sharing client data? Now, recently, folks, we started an MES revenue system where we actually now have developed a EHR system, electronic healthcare record system for our MESs that is HIPAA compliant. So for you, do you have a HIPAA compliant system, meaning that it's going to protect the client's confidential information? You're not leaving client files out on the desk in your studio or in the break room or on a piece of equipment where someone else can come along and look at them. And let me explain something real quick. This whole thing of HIPAA came along in the in the 80s when I started practicing as a therapist back in 85. And it really hit a crescendo in the late 80s, early 90s. Here's what we found. For seniors that were coming into the hospital for clinic visits, outpatient visits or for surgery, where the greatest amount of identity theft was going on? In the hospitals. So the federal government set up a guideline to say, hey, if you're going in for healthcare services, you must provide security for these individuals' documents. And in a lot of inner city hospitals, a lot of rural hospitals, this was going on at a rampant pace. So this is why HIPAA becomes so important. Please, if you would, recently we had an MES who was carrying his client files around with him from client to client as he was going to clients' homes. Great. Well, he left those files in his car one day, in a container in his car, and someone broke in the car and stole everything, including the client files. That's a HIPAA violation. So please, if you would, make sure with regard to your client files, you're able to put them under lock and key at night. Now, if you live in a home and you have them in your office and you lock the front door of your home, that's under lock and key. If you have a clinical setting or a studio setting, make sure that you're able to put these client files under lock and key in a file cabinet. And if you can't, put them in a room that you can actually lock. So if somebody does break in, you're protecting the client's confidential information, their social security number, their address, their Medicare information, if they're covered by Medicare, or their third-party insurance information. All right. So let's move on to the next item. Item number 3, outcome tracking and reporting. Now, I don't know how you feel right now. You may say a little bit of ouch as we've gone through the first 2, This one now is going to ask you even more challenging questions. Do you track client progress using functional outcome measures? Now, folks, I showed you our advanced medical exercise specialist manual a little bit earlier. These FOMs, or functional outcome measures, are what we've identified, and not, I won't say us here at the Medical Exercise Training Institute, but these have been used by the medical community, the fitness industry, insurance carriers, as universal measures that we can use to determine if a client's medical condition is improving based on these functional outcome measures, things such as blood pressure, heart rate, functional assessment scale, strength, range of motion, things of that nature. So the question here is, do you track client progress using functional outcome measures on an ongoing basis? Next item, can you produce objective outcome data that supports client improvement? So when you tell the doctor, therapist, or chiropractor client's getting better, you actually can document that by looking back on your session logs and your progress reports and saying, here are the numbers, I've measured this, and you've measured it appropriately and correctly. Here are the numbers that support the client is making progress. Next item, do you review and adjust exercise programs based on measurable progress? Not that they just feel better, they have more energy, they feel like they have more, but you're seeing an improvement in the strength, the range of motion. Their Tonetti gait and balance assessment numbers are improving. You've used other functional assessment scales, or you've checking their heart rate, their blood pressure. They've gone back to the doctor, they've had their A1C checked, or they did a bone density test, and it's showing that the exercise is helping with their condition. All right, that takes us now to our next section here, referral network and outreach. All right, now this one is a good one. I find a lot of medical exercise specialists, when you get your certification, you want to market to every medical professional in the community. You just send out a blanket letter to everybody, which is great. And you will get some folks that will bite and start sending you a couple of referrals, but you should do a little bit more specific or have a little bit more specific marketing plan where you're actually targeting medical professionals in your community that you want to establish referral relationships with. I'll say this, and I'll say it for physical therapists, for chiropractors, for physicians. There's some medical providers that you may find you just don't mesh well with. And what you might want to do is a little bit of homework. So if you would, item number 4 here, do you have a defined list of potential referring professionals? Where you've looked at your community and you said, yes, I might be able to get referrals from Dr. Smith or therapists at the local physical therapy clinic, or the chiropractor, or maybe the local internal medicine doctor or orthopedic clinic. So you now have actually determined who are targets or individuals that you feel like you can develop a referral relationship with. Let me give you a little word of advice. Don't do that shotgun method where every doctor, every therapist in the community, I'm just going to send them a letter. It may be effective, but what you may want to do is looking at a targeted list of medical providers that you feel like, based on your interaction with clients who've said great things about them, what you've heard through the community, are individuals that you want to get referrals from. And I would recommend that you start with a list of 3. A good internal medicine doc or general practitioner. Number 2, a chiropractor. We find chiropractors for over the last 31 years, as we taught the MES, are the most receptive to medical exercise professionals approaching them for referrals. And then thirdly, I would look at a physical therapy or sports medicine clinic. The reason we put them third is to make sure you've gotten your elevator speech down, you clearly understand your scope of practice. So when you go in and you talk to that therapist, you don't ruffle any feathers, you don't make them think you're in competition, but you're there to augment their services after the patient has been discharged and becomes your client. Next, with referral network and outreach, have you delivered any educational materials or done presentations to medical professionals? Folks, that's part of the process. And please, if you would, don't feel bad if they don't the next day nominate you for an Academy Award for your presentation or give you a Pulitzer Prize for your educational materials. Everybody is knocking on that physician's door for sure. Most of those people are knocking on the therapist and chiropractor's door, trying to market their services. So don't feel bad if you don't get an immediate response. You aren't nominated for a Pulitzer for your educational materials or Academy Award for your presentation. They're getting these presentations from everyone and everybody out there. But do follow up. And please, if you would, make this note: the best friend you can have in the medical office is the office manager. After you do that presentation, follow up with the office manager. Get to know his or her first name. They become your best friend because in many instances, they're the gatekeeper to that medical provider. And you may find getting in to see the medical provider is extremely difficult, but getting in to see that office manager and asking questions, making your marketing pitch, or even asking questions about clients you have, getting documents signed, they become your best friend. Next item here, do you follow up with medical professionals after a referral is made? If nothing else, just to thank you. Folks, I was in private practice for 14 years. The doctors that we had that referred to us, we knew them on a first name basis. We sometimes socialized with them, but I made it a point every time we got a referral from a physician, I always thanked the referral source for that referral because they had a lot of different options out there. So it becomes important that you do follow up with a thank you, but also follow up with progress reports. Folks, think about this. The physician, therapist, or chiropractor referred the client to you for ongoing exercise because it was part of the medical management process. That client goes back to see the physician or the therapist or the chiropractor on a follow-up visit a month later. Do you think that the client can give the doctor an accurate, or therapist or chiropractor, an accurate assessment of the exercise program that you've given them without sending a written report? Now, please, if you would, your progress report or your follow-up report should be no more than 1 page in length. Do you think your client could actually accurately tell them what you're doing? No. And if they've referred them to you, they want to get that progress report because guess what? It's part of the medical management process. So please, if you would, make sure you do follow up medical professionals after a referral has been made to say thank you, but then also ongoing follow-up reports or progress reports to let them know how the client is doing. All right. Next item, confidence and consistency. Now, I know after the doctor has blown you off, you feel like the therapist has blown you off. They didn't tell you your progress report was great. They didn't say your presentation was fantastic. They didn't send anybody. You just got to fight through that. You have to have confidence that I know what I'm doing. I offer great services and the results I produce so far are good. And I've got to be consistent and keep knocking on that door. I told a story in our last session about a doctor I met at a social gathering years after I'd moved out of the District of Columbia, sold my practices, but he referred to me on a regular basis. We never met in person when I was in practice. We met at a retirement party for another physician. So please, if you would, make sure that you think about confidence. Even though they don't refer back to you, don't worry about it. You'll get a referral eventually from them, and be consistent. Don't let lack of referrals knock you down. And please, if you would here, let's read these items. Do you feel confident discussing your services with medical professionals? Folks, you're the exercise expert. The doctor's not going to ask you about reading x-rays or ordering a CAT scan or medications. He or she's only going to ask you about exercise, which is your area of expertise. You have to feel confident about that. I'm confident I can provide exercise programming, safe and effective exercise programming for your client, Dr. Smith, or therapist John, or chiropractor Dan, whatever the case is. Can you clearly articulate who you serve, what you do, and how you help people? That was in our elevator speech session last time. You should be able to just roll that off your tongue without a lot of difficult language or scientific language. Make it such that an 8th grader can understand what you're saying. And the last thing, are your systems consistent enough to handle multiple referred clients at once? And folks, that's the real test. You got one referral from Dr. Griffin 3 months ago. Great. Now suddenly you keep marketing to Dr. Griffin, and now he suddenly refers 2 or 3 clients to you. Oh, do you have enough space on your schedule so you can schedule that client in for an assessment? But remember, once you assess them, they're going to need 2 or 3 sessions a week, and you don't have any space. You now call Dr. Garrett back and say, Doc, I can't see this client. Is he ever going to refer again? No. So half the battle, folks, is making sure that you have the ability to deal with these referrals. And with these referrals coming in the door, you can now handle the referral, and you can do that consistently on an ongoing basis and be able to provide the follow-ups and everything else. So this practice readiness checklist, this asks you a lot of challenging questions. There are a lot of things you have to do. And over the course of the remaining days we have left in our 30-day challenge, we have 27 days left. We have a lot of things to do. But don't feel bad. Don't feel discouraged. It's a process. It was a process for me when I went out and opened my first PT clinic. It's a process for every doctor that goes out and opens their practice. It's a process for everyone. It's a learning process. Don't feel bad. Now, please make sure you downloaded that readiness scorecard. If you are watching the video, down below, you should have a link where you can actually download this readiness scorecard. And please, if you would, make sure that you look out for an email. We're going to relaunch our Medical Exercise Specialist Network on May 22nd. We're going to take all these recordings from this 30-day challenge. We're going to put those in the new network. We're going to use a new platform, the Circle community platform, for our new MES network. And we hope this will be an area where you won't just simply come and learn exercises and be able to chat with other people, but we want this to be an area or a community where you're learning to build your practice. We're giving you the components and the guidelines, the protocols, the little tips to help you build a strong medical exercise training practice. We have enough certifications out there, enough workshops. We need someone now that's going to help you build a better practice and a better business. So with that, please make sure you go over to crackingthecode.net. That's where we will have the recording for this in a couple of days. We also have an ongoing Friday webinar series that is 100% free, helping you build your medical exercise training practice. And with that, thank you, folks, for joining us this morning or this afternoon, depending upon where you are. The recording for this will post sometime tomorrow. And please, if you would, make sure you check your email for our next session, which will be tomorrow, day number 4. And we'll continue on with helping you build a strong and profitable medical exercise training practice. And with that said, we'll see you next time. We'll see you tomorrow. All the best. Take care.